Hello and welcome back. Today we'll go through chronic granulomatous inflammation. This is the last session about inflammation. Let's begin with a case. A 40-year-old man had a cough, remittent fever, and light sweats for 2 months. A chest radiograph showed bilateral nodular densities located mainly in the upper lobes of the lungs. A sputum sample revealed the presence of acid-fast bacilli. A transbronchial lung biopsy was performed. This is the microscopic view of the biopsy specimen. We can see a nodular lesion, the center of which shows an amorphous granular pink appearance with loss of cellular details, indicating central caseous necrosis. This necrosis is surrounded by a wall of cells with abundant pink cytoplasm with undefined cell boundaries, which are called epithelioid cells. Among these cells, we can see multinucleated giant cells with regularly distributed nuclei called Langhans giant cells. Both epithelioid cells and Langhans giant cells are macrophage-derived cells. At the periphery of the nodule, there is a rim of lymphocytes. Therefore, this nodule is a tuberculous granuloma. The pathological diagnosis is pulmonary tuberculosis. Granuloma and granulomatous inflammation are today's topics. After this session, you are expected to know what is chronic granulomatous inflammation, what is a granuloma, what are the types of granuloma, what are the principal cellular components of a granuloma, how do we describe the morphological features of these cells, what are the morphological features of tuberculous granuloma and foreign body granuloma. Chronic granulomatous inflammation is a morphologically specific pattern of chronic inflammation characterized by the formation of granulomas. Granuloma is a nodular collection of proliferating macrophages and macrophage-derived cells surrounded by a rim of lymphocytes and fibroblasts. Older granulomas have more fibroblasts in their peripheral areas. Healing of granulomas is accompanied by fibrosis that may even result in organ dysfunction in some diseases, such as tuberculosis and silicosis. Granulomas caused by different pathological processes exhibit distinctive histological features and hence may help doctors make an etiological diagnosis. If the morphological appearance of granuloma is not typical, it is necessary to identify causative agent by laboratory tests, such as special stains for organisms or culture. Cellular components of a granuloma include macrophages and macrophage-derived cells, epithelioid cells, and multinucleated giant cells. Macrophages are activated and transformed to specialized cells for phagocytosis and antigen presentation. When they attempted to phagocytose persistent antigens or foreign bodies, they would transform themselves into epithelioid cells or multinucleated giant cells. Epithelioid cells form a dense cellular barrier, just like epithelial cells, isolating the microbes from the surrounding tissue, and so preventing microbial dissemination. Multinucleated giant cells are formed by the cytoplasmic fusion of multiple activated macrophages and epithelioid cells, such as Langhans giant cells and foreign body giant cells. In chronic granulomatous inflammation, we have infective granulomas foreign body granulomas and others. Infective granulomas are mainly caused by persistent T-cell mediated immune responses to certain microbes that cannot be readily eliminated by phagocytes, such as certain bacteria, fungi, and parasites. Foreign body granulomas are seen in response to foreign bodies, which are not easily engulfed and broken down by macrophages, including exogenous materials such as wood splinters, talc, surgical suture, or endogenous substances that the host immunity system identifies as foreign, such as cholesterol and mucus. Through T-cell mediated immune responses or sequestration of foreign bodies, macrophages are activated and transformed into epithelioid cells or multinucleated giant cells. Next, I'll introduce the morphology of infective and foreign body granulomas. The tuberculous granuloma caused by Mycobacterium tuberculosis is a typical example of infective granulomas. Its principal cellular components are epithelioid cells and Langhans giant cells. Microscopically, epithelioid cells have abundant, finely granular and pink cytoplasm with indistinct cell boundaries, resembling epithelial cells. Their nuclei tend to be round or stringy, lightly stained with a clear nuclear membrane and small nucleolus. The Langhans giant cell has large amount of cytoplasm and many nuclei arranged in the periphery of the cytoplasm in a horseshoe-shaped or ring-like pattern, and is particularly characteristic of the tuberculous granuloma. A typical tuberculous granuloma has a central core of caseous necrosis, surrounded by a wall of epithelioid cells mixed with Langhans giant cells. The periphery of the granuloma consists of a rim of lymphocytes. This high-power micrograph more clearly exhibits central caseous necrosis surrounding epithelioid cells and Langhans giant cell. The foreign body giant cell is the main and characteristic component of foreign body granuloma. In order to engulf large foreign bodies, multiple macrophages surround the foreign bodies and fuse to form multinucleated giant cells, which are called foreign body giant cells. Microscopically, the foreign body giant cell has many nuclei randomly scattered in the cytoplasm, within which we can sometimes find the engulfed foreign body. What is the morphology of foreign body granuloma? The foreign bodies are often found within the foreign body granuloma. They are surrounded by foreign body giant cells and macrophages with peripheral accumulation of lymphocytes. This is a foreign body granuloma formed in response to cholesterol crystals. These empty clefts were cholesterol crystals, surrounded by foreign body giant cells and macrophages. The cholesterol crystals were dissolved by the organic solvents typically used in sample preparation, leaving the empty clefts. This is a foreign body granuloma in response to extravasated mucus from an injured gland. We can see that the mucus is surrounded by many foreign body giant cells, with some peripheral lymphocytes. This is a foreign body granuloma produced in response to surgical sutures. These gray-blue strands are sutures, which are surrounded by foreign body giant cells, with peripheral accumulation of lymphocytes. Now it's time for a summary. Chronic granulomatous inflammation is chronic inflammation characterized by the formation of granulomas. Granuloma is a nodular collection of macrophages and macrophage-derived cells, including epithelioid cells and multinucleated giant cells, surrounded by a rim of lymphocytes and fibroblasts. In this session, we have discussed tuberculous granuloma and foreign body granuloma. Tuberculous granuloma mainly consists of epithelioid cells and Langerhans giant cells with central caseous necrosis and peripheral lymphocytes. A foreign body granuloma is formed by foreign body giant cells and macrophages surrounding the foreign bodies and with a rim of lymphocytes. We have finished the online course of inflammation through 8 sessions. Thank you for attention. These are my references and acknowledgement. Next, you're welcome to the online course of neoplasm. Bye-bye.